59-year-old Nick Russo loves farming, and he's devoted his life to it. But a few years ago, severe angina threatened all that. Obstructions in his arteries were preventing his heart muscle from getting enough oxygen. He had severe chest pain and shortness of breath.
I could be sitting having supper and be getting angina. You could just feel it moving up, and then you get right here. I never knew when, hey, maybe this is it.
Then Nick found help at the Heart Center in Mount Laurel from a new non-invasive treatment called ECP.
Before I had ECP, I was always afraid to do things because I was afraid that maybe I'd get angina. And I would. After I had the ECP, I try anything I want to do now, and it works.
Nick Russo's just one of the Heart Center's success stories.
How's Mr. Schiavone doing?
Dr. James O'Neill is the center's medical director. He brought ECP to Burlington County.
ECP stands for Enhanced External Counterpulsation. It's non-invasive, nothing enters your body, it's no risk.
Cuffs attach to the legs and buttocks and inflate when the heart is relaxed, and that
forces the blood flow at high pressures back through these arteries, creates shear forces that we think causes collateral blood vessels to improve. They're small, they get bigger. Ones that weren't there develop. It's so simple that I really didn't even believe it initially. Nick Russo was an interesting patient because he was really severely disabled. He was no longer able to perform his farming functions, even driving the tractor. After his 7 weeks of treatment, he had probably more relief of symptoms than any other patient we've had. He's almost been angina-free since his treatment.
Marie Tuno rarely stands still. Besides her many civic activities, she practices Tai Chi, works out at the gym, and goes ballroom dancing a few nights a week. But she was having trouble.
I was having chest pain. I just needed frequent naps. I wasn't able to dance. It was very difficult to keep up with the pace.
So Marie found ECP and is undergoing treatments.
This is Marie's EKG, and the machine is timed according to her heartbeat. These cuffs, they inflate sequentially and push the blood back to Marie's heart. We time the machine by putting this on Marie's finger. How are you feeling, Marie? Is anything bothering you, or your legs hurting?
No, it's very comfortable.
You're
It's
comfortable?
Yeah, I mean, bouncing up and down, but I'm comfortable.
And the thing that she's noticed since she's done the ECP treatments is that she has much more energy. She's able to go back and do her dancing 2-3 nights a week, and also the Tai Chi.
The fact that I'm able to do all that I do without any discomfort makes me feel like I'm alive, as opposed to like laying there, sleeping all the time.
The Heart Center's expert staff includes 13 cardiologists who can see patients quickly and registered nurses trained in cardiac care.
I think our staff is better suited to recognize patients' symptoms or problems if they could occur.
Oh, they're wonderful. Absolutely wonderful.
And ECP is covered by Medicare. Calvin Washington was tired all the time, too, and was once rushed to the hospital for chest pains.
After 53 years of living, never being hospitalized in your life, I've always been active, and I had to really sit down, and it scared me. But after I got started with the EEC program, I was ready to start all over again.
And Calvin isn't the only one who's thankful. So is his wife, Patricia.
She really cares about me, and I can tell you that she says, well, I'm glad I got my husband back. I'm getting there, and I will be 100% again. And it's because of the ECP. I know that.
This outpatient treatment at a fraction of the cost is getting almost the same relief of symptoms that these high-tech invasive procedures afforded to patients. But we've noticed, as other people have noticed, that there's a lot more that they get. They get an improved sense of well-being, improved energy. They dance when they couldn't dance before. They could farm when they weren't farming like they did before.
I feel better up here. Now I have a feeling of assurance that, hey, things are going better for me now. And if we want to go on a little vacation or something, we do that too. And I feel very good about leaving. I'm not afraid to go now. Yeah.
I mean, it can't hurt you in any way. It's perfectly safe. It's not like having surgery or being cut or taking medication. I would highly recommend it.
Thank you, Lord. I feel good. That's all I can say.